Dr. Ryan is here today to share his wealth of knowledge and expertise. I'd like you to welcome him. Thank you very much.
Thank you, Andrea. Thank you so much. I think I can take this one. Thank you. We were saying, I think, 2 years ago that I was here, and it was a treat. People were very kind, and they're engaged really, really well. So I hope that that's something that we can continue with even today. So when Devika contacted me, I think, about 2-3 weeks ago, I forget exactly, saying I think it's that time of the year that we need to go ahead and have a chat about how we sort of prepare ourselves for flu season. I was like, sounds like a good idea. One of the things that always reminds me that things are a bit different here in Dubai is that I don't know that we have a specific flu season. I think we have a flu year. And I think because, you know, as we come in now to the winter part of the northern hemisphere, that's where we sort of link this flu season. But I think because we're in contact with people from the north and the south all the time, we are continually exposed here, probably more than most places in the world, with the number of people that are coming in and out. So I think that this kind of talk is helpful not only for, you know, sort of the northern hemisphere winter, but pretty much all year round. And the principles apply to pretty much everybody all the time. So I hope that that is going to be something that will be helpful, again, not only for the coming months, but pretty much for the rest of the year and the years that come as well. So generally, in terms of when we're looking at infection, when we're looking at the things you know, that we would typically associate with flu season, the first thing we need to recognize is we all get sick. You know, that happens. The tendency, however, is for children, and the elderly obviously, but children especially, to get even more sick more regularly. We see that children under the age of 12 seem to be more susceptible than those slightly older, and children under the age of 4 especially susceptible. And the reasons are pretty simple. Their immune systems are still developing, and they usually don't have a great idea of how best to prevent those things through contact or, you know, hygiene and washing hands, and they're very social and interacting, and they spread these things very freely and very kindly. But what we need to have a look at in many respects is the fact that it's going to happen to us, to our children. So how do we actually deal with that? Now, the typical things that people will get, colds and flu and the odd gastro, these kinds of things, for the most part, they are self-limiting. You know, they're mild, they can be an inconvenience, they don't cause too many issues. But the reality is these everyday kinds of conditions can also be severe. They can be, in fact, even life-threatening. And as I was mentioning to Devika a little bit earlier, I had the unfortunate experience in the earlier part of this year of 2 such cases. I was in South Africa on holiday. I think we flew on about the 28th of June. My brother-in-law is a medical doctor in emergency setting in one of the cities there, and he was coming to fetch us from the airport, and I could see he was a bit down, and I was asking, you know, what's the issue? And he said he just had the most horrific experience, you know, over the last day or so. A 19-month-old who he knew the family had died from the complications of flu. That's this year, in this day and age, in an environment where you would be thinking that shouldn't happen. The way he described the case was, this was a family of 5. This was the youngest of the children. There was something possibly not 100% with this child genetically, but, you know, they were still sort of trying to see what that was more specifically. But the family had been ill. All the children were sick. They had flu for about a week. And this particular family, unfortunately, didn't have medical insurance. They had taken the little one to a government hospital, and they had been sitting there for about 4 hours and realized something serious was happening. This child was in severe respiratory distress. They knew that my brother-in-law John was you know, at the hospital in the casualty at that particular point. They took the child, they rushed there. He said they literally placed the child in my arms, and I knew this was a real problem. And John, in terms of his experience, he was first trained as a paramedic and then a medical doctor, and then a casualty specialist. So that's as good as it gets when it comes to emergencies. And he said to me, I looked at this child and I knew if I intubate this child is in ICU, this will cripple this family financially. So he was looking at it and thinking, how do I try and manage this particular case as best I can, weighing up all of these factors? He said he did pretty much everything he could. He managed to stabilize the child. And then unfortunately, he went away to tend to other patients. When he came back, the mother had taken the child off the nebulizer to feed, and this child was in massive, massive respiratory distress again. John had to intubate. He said that he intubated 3 times, each time thinking he had missed, but he had actually placed the tube correctly. But there was such tremendous consolidation on those lungs that even ventilating, he could not even bag to get air into the lungs. And the child died the next day. So we sat and we were like, this just shouldn't happen. You know, this is something that people should recover from without significant complication, but it did. 3 weeks later, I was sitting with somebody and they said, did I hear that this other person we knew, this 60-year-old, had died? I was like, yeah, from what? And they said, from flu. I was like, you know what, that's the second case in a matter of weeks that, you know, people are dying from something that you would think ordinarily you get better and off you go. And it just highlighted for me again the importance of being able to recognize that some of these kinds of conditions, as sort of benign as they can be for the majority of the time, still need to be treated with tremendous respect. So we look at these, we listen to these kinds of horror stories. Oftentimes we're not even giving it much thought because we're not exposed to these kinds of things. But the reality is, again, it can happen. Thankfully, it's less likely to happen in a sort of a socioeconomic sort of setting as we have, because for the most part, things are in place to go ahead and tend to that and prevent that from happening. However, it's important for us to realistically be mindful of the fact that we need to, again, manage these things well. So the obvious question is, how do we avoid this? How do we avoid these kinds of things from happening? Because they usually come without warning. It's not something you necessarily plan to get. We should be planning to avoid. So the logical thing is, how do I make sure that we can try and prevent this kind of thing from happening? That's the first thing. If I can prevent the infection in the first place, then the likelihood of complication is taken out of the equation. And that's really, for the most part, where I'd like to focus today. So there are a number of things that we can have a look at when it comes to your children or even yourselves or your husband or wife. What one is looking at generally is, how can I maintain a good baseline level of health? And it's not rocket science to figure out that people who generally eat well, who exercise well, who rest well, who, you know, for the most part, in my opinion, supplement well, who smile a lot, these are the kinds of people who generally are less inclined to pick things up. And when they do, they're usually the ones who get through without complication. So in many respects, that's a good place to begin. And when it comes to diet, again, I have a very, very simple 6-point recommendation when it comes to nutrition, and it would apply both to general health, prevention of illness, weight management, etc. So I'll give it to you as a quick by the way. So the best diet for a human being is simply this: a good variety of clean, whole foods, plant strong, mostly raw, in quantities that get you to the weight you want to be. So I'll repeat those for you quickly. So it's a good variety of clean, whole food, plant strong, mostly raw, in quantities, again, that keep you or get you to the weight that you would like to be. Now, when you look at that, that means plenty of salads, fruits, vegetables, soups. That's really what we should be eating primarily. And if we're doing that, the reality is we're feeding our body in a way that provides it with the nutrients, with the building blocks, with the micronutrients and cofactors that allow it to function at its best. And the goal of the body is to survive for as long as possible. So when you provide it with those kinds of things, it generally tends to do that very, very well. So from a dietary perspective, The idea is, can I try and avoid for myself and for my children as much as possible the unnecessary kinds of things that are highly processed, that are highly refined. This is pretty much common sense. It's just not always that easy when the environment presses so much on us to have these kinds of fun foods. I'm not of the opinion that a diet should be perfect. The reason being there is no perfect diet, right? I do think, however, that doing the good things most of the time is extremely helpful, and it is genuinely doable. So those are the kinds of things that we look at as a baseline. Making sure that there's enough hydration, making sure that there's enough water intake is also extremely helpful. The body needs to be well hydrated in order to actually function at its best. So these, again, this is common sense, really. Somebody mentioned, or was it Andrew who mentioned, now the weather is cooling. This allows for more time outside. That's excellent. I think it's very, very important that our children spend as much time as they can engaging in physical activity. Exercise is a fantastic way of just supporting general function. In fact, it might be the healthiest thing a person can actually do. And what we realize is it's also something that is useful for coping with stress. Now, I think I might have mentioned it before, and I'm sure I've spoken to Devika about it, but probably when I was first in practice about 20 years ago, I remember sitting with some teachers and parents and some students, and mindful at that particular point in South Africa that there was a big push towards privatizing schools and all these kinds of things. Everybody was so stressed. I remember seeing 7-year-olds with depression and these kinds of things. And what we know, the reason I bring it up is because highly stressed situations, which I suspect are happening in most schools with everybody involved, also have an impact on immunity. That, in fact, even just an article that came out in one of the journals this morning was highlighting how stress is associated with an increased risk of infectious disease and serious infectious disease. So when we make the sort of statement that it's good for your kids to get outside and play and engage in physical activity, we must not underestimate the breadth of value that adds to health and well-being, both mentally, emotionally, and physically, and again, in terms of preventing infection or reducing the risk or enabling them to cope better. So again, a good diet, physical exercise, good stress management, good sleep. So important for our kids to get enough sleep, right? That's challenging at times. It's challenging for us. None of the things that I'm pointing out are necessarily easy always to follow through with, but they are doable. And that's the important part. So when you start looking at these things with the basics, it's also helpful to consider that within the prevention, it's useful to go ahead and try the sort of barrier techniques of ensuring that when there is exposure, typically to viral kinds of infections, there is a way in which the body has a first line of defense. And that means washing hands. So it's a great idea when kids get home from school is get them to wash their hands. Get them to wash their hands before they eat. These are, again, this is pretty much common sense, but they're very, very helpful practices for reducing the ease with which a lot of these infections are spread. On average, not even a flu season necessarily, but on average, people are exposed to about 10,000 viral hits a day. And when those penetrate through nose and mouth, that is when the likelihood of infection is increased. So it's good for us to keep hands away from the face. It's a great way to try and help your kids keep the fingers out of their noses and their mouths, right? Not always easy. I have a 10-year-old who loves to put her thumb in her mouth still, right? But it's one of those things that we really can try and help them to try and reduce, again, the risk of picking up these kinds of infections. One of the things Devika mentioned as well earlier was I hope you're going to speak about pollution. The reality is we live in a place that, frankly, is quite sickly. The things that we breathe in, the things that we are exposed to, hammer our immune systems. There's not a whole lot we can do about the breathing part because we need to breathe, right? So it's not something that we can tend to that easily, but it does heighten, again, the value of the first point in terms of a good diet. A good diet provides the kinds of nutrients that your body's detox processes and mechanisms, it provides the kinds of things that enable them to function at their best. And that is certainly something that we need to be mindful of. So the beauty of a lot of the things that I'm mentioning right now is they have multiple benefits. It's not just a matter of preventing illness, but instead, when people are doing these kinds of things, when they're living well, they tend to do well in most areas. And when they're tending to do well in most areas, they tend again to be less susceptible to the kinds of infections that we're talking about. And if they do pick them up, they tend to get over them more easily. So when we look at prevention from that side, that's again stuff that you can do that for the most part costs you nothing nothing extra. One of the areas that I have always paid close attention to is the area of supplementation, and I believe that that is something that every single one of us need, no matter how well we're living. There are people who will disagree with that, and they're welcome to disagree. I know what we would do as a family, and I know what I would recommend, and I think that over the years that has proven to be hugely beneficial. So what I mean by that is to support even a good diet, because as I said, even when you're following a good diet, the likelihood is you're going to be deficient in certain areas. And when I mean deficient, not to produce a disease, but to prevent optimal function. And what we're looking at here is, again, we have the luxury of not being the kinds of people who are trying to avoid the kinds of diseases that are, again, the result of deficiency, a lack of food and micronutrients. But we're looking at things saying, how can we go ahead and make the most of what I've got? And in my opinion, supplementation is a key component to that. So as baseline, it's helpful for children and adults alike to supplement with good vitamin, mineral, and sort of cofactors. And the idea there is, again, to try and select the ones that are derived primarily from food. That would make the most sense, right? If we're going to supplement or we're going to top something up, let it be of the same kind that we would ordinarily get from our food. Unfortunately, a lot of the things that are on the market are synthetic. So the body doesn't recognize them as a nutrient, but rather recognizes it as a drug, right? That's the kind of action they're having. So at best, they may be mildly helpful. At worst, they can actually be problematic. So the idea is when you are looking to supplement for your family, make sure that you're getting the kinds of things, the vitamins, the minerals, enzymes, probiotics, glyconutrients, essential fats, those kinds of things from a natural source. And the good news, again, is that these kinds of things are available. And those would be the things that I would put in place baseline year-round. But they would do very, very well in a time when there is an increased risk of things like communicable disease or infection. Beyond that, however, I think it's helpful to recognize that there are certain things that we know are wonderful immunomodulators. In other words, they can actually help support the immune system. So I highly recommend in times like this that people consider taking things that would be supportive for the specific immune functions in the body. Now, I brought a couple of things just to show you what kinds of things are available. This is not a sales pitch. This is just for you if these are the kinds of things that you would want to consider. You get things like first food colostrum. These are things that help support immune function. I see this as particularly helpful in kids who have tendencies towards asthma, tendencies towards things that will increase their risk if they do pick up colds and flu. We have a new product at the moment called Immune Pro. It's probably one of the best glyconutrient supplements that is available. We've seen how incredibly beneficial it is to, again, reducing the risk of infection, and also when people actually get it or pick something up, that they're able to get through it significantly more quickly and without complication. These are things, again, that are available, right? So the intention here is not to try and, again, sell you on a product. The idea is to say, at least factor these kinds of things in. I have no doubt that you've been exposed to things like probiotics. I highly recommend them as well. People will be highlighting and pointing out that good gut health is very, very important for good immune function, and that's true for the most part. So these are things that you can be looking at to sort of support the, again, dietary, sleep, hygiene, the other kinds of things that we've already mentioned. The reality is, if you do those things well, there is no question that you can reduce the risk of contracting these kinds of infections, colds and flus and the like. So for yourself and for your children, if you were to go ahead and do that, as we said, that would probably go a long way in reducing that risk of sort of the nasty complications that I sort of mentioned a little earlier. But beyond the actual prevention, which again I still maintain is first place, that's where we need to focus on first, it's also helpful to recognize that the majority of infections that our children are going to get are going to be viral. And that's a very, very important thing to recognize, because viral infections are for the most part self-limiting. In other words, they are going to get better on their own. Okay. Now, the reason this is such a big deal is because I have no doubt that over the last months or years at least, you've been hearing about the risk that we're starting to face, or that we are facing with antibiotic resistance. Antibiotic resistance is simply saying that the drugs that would normally treat bacteria in the past are seemingly losing their impact or effect because the bacteria themselves, as they are trying to survive, have developed ways to sort of circumvent the action of the actual bacteria, or of the antibiotic rather. So what that means is a person has an infection that previously was treatable is now virtually untreatable. So we're almost finding ourselves in situations, and especially in hospital settings, where we are pre-1940, before the time when antibiotics were first discovered. And the risk there is that you might have somebody who, again, goes into a hospital kind of setting who is otherwise well. They might be going for a routine procedure, but they're exposed to things that, again, we no longer have treatments for. And the reason that is the way it is because of the overuse of antibiotics for a sustained period of time. And one of the biggest areas that overuse has been happening is in the treatment of viral infections. So the scenario is fairly simple. I can think of a case even last week where a mom said to me, took the children swimming on the Friday. That's allowed, by the way. Swimming is not going to kill anybody. But she said, shortly after they'd been for the swim, this little one had started with a fever, and it was obviously the pool, but they took the child to the pediatrician. Straight away, the pediatrician did, number one, a blood test, did a throat swab, and prescribed an antibiotic. And I'm like, how's the child today? Because she probably come to see me, I think, on the Sunday. Or even, sorry, it was even a week after that. How is the child? Child's fine. How did the child sort of, cope after the fever and that sort of thing? Well, the fever wasn't there the next day. Now, the assumption there is, well, the antibiotic did the work. And that's unhelpful because the antibiotic didn't do anything, right? So you look at a situation like this and you say, this was a child who, in all probability, had a basic upper respiratory tract infection, viral infection, okay, that would typically run a course of maybe 3, 4, 5, maybe 6, 7 days, 10 days probably at the most, okay? But this child is now being given an antibiotic, okay, completely unnecessarily. But the antibiotic is not something that is without, sort of consequence itself. People have allergic reactions to antibiotics. There are a high number of cases that end up in emergency due to reactions to antibiotics. Let me be clear on this. Antibiotics save lives. They are an amazing discovery, of the most incredible discoveries in medical history. But again, they have their place and they should not be used outside of that place. So when we use, again, an antibiotic in that situation, we increase the risk of a reaction, such as an allergic reaction. We also go ahead and we knock out the normal flora that is part of our bodies, because oftentimes these antibiotics are broad spectrum. So they knock out what's happening in the nasal area, they knock out what's happening in the gut. And again, by causing that sort of disruption within these areas, we actually increase our risk of other infections and other problems. So when we start seeing that treatments are given for conditions that do not require that kind of treatment, we realize that we are actually compounding problems at multiple levels. We increase the risk of children's allergies, we increase their risk of, again, potentially even asthma through the use of these kinds of inappropriate prescriptions. And the reality, again, is it really, really comes down to us as parents in many respects to be on top of these things, so that when we do take our children to the doctor, that we're trying to make it clear to the practitioner that you are not pressing them for an antibiotic. And the reason I say that is because I often sympathize with the medical profession as a whole. They're usually pressed for time, okay? You usually don't have half an hour or an hour with your general practitioner or your pediatrician. The easiest thing to do for them is to go ahead and write out a prescription. And usually that is also because of the pressure from the parent. Certainly know that if a person brings their child to a practitioner, they're expecting something to be given. There is an expectation. And rather than have the discussion as to why the expectation need not be met, it's easier to just give what the person requires. So this area, again, of unnecessary prescription is one that needs to be tackled by both practitioners and parents alike. You're the ones that I get to speak to now, and highly, highly encourage you, if you do take your children to the doctor, always be very, very clear that unless the doctor is convinced it is a bacterial infection that requires antibiotic treatment, be quite clear with them that you are comfortable with the fact that they don't have to prescribe the antibiotic. You will go a long way in doing good for yourself, for your children, and even for that practitioner. Just as a side note, I attended a talk a couple of months ago. There is a huge push here in the UAE as well to try and get up to speed with sort of World Health Organization standards of antibiotic stewardship. In other words, they are trying very, very hard in the hospitals to try and reduce the amount of antibiotics and that are prescribed, even at surgical levels, etc. So they're trying, and I think we can go a long way to try and help them in that process, bearing in mind, you know, it could be us 20, 30 years from now who need a knee replacement or a hip replacement or something that should be, again, pretty routine, that ends up putting us at risk of some sort of multi-drug resistant organism, and we end up with horror stories on the other side. We can do something about that now, and my encouragement is that you really take that responsibility where you can. So we're looking at that and saying, okay, let's try and avoid the unnecessary prescription of medication that is not helpful in the kinds of things that we're typically looking at. So in saying that, it's probably helpful for me to go ahead and help you try and distinguish between what is a cold and what is a flu. And I'm always amazed when a person will come to me and say, I have flu. And they're pretty jovial and they have a few sniffles, and I'm like, yeah, that's not flu, right? A cold is typically from the throat up, okay? So it might have a bit of a sore throat, typically runny nose, typically sneezing, maybe watery eyes, a bit of a thick feeling in the head, maybe a low-grade fever. But usually it's not the end of the world, unless you're a man, obviously. But usually that should be something that one copes with, as I said. It normally runs its course. Don't allow the color of sputum to determine whether or not an antibiotic should be used. Okay, so typically when it's running a course of a cold, the clear mucus and that is what begins, and typically after 2, 3, 4 days, people say the cold is ripening, right? There is typically a thicker mucus, worse in the mornings, typically clears through the day. Those are not indications, again, that there is something secondary, which is what we're looking out for. That's what we don't want. We don't want a secondary or a complication. Okay, so that's typically a cold. Most of the times, the kid's appetite will still be okay. They'll still be up and about. They might have, again, blocked nose, difficulty sleeping at night, and that means longer night for you. Okay, flu, different story. Okay, flu typically presents with an intense fever, lethargy, headache, body ache. They're sick, okay? Usually with a cough, usually not with lots of runny nose or sneezing. So it's normally a cough, a headache, a fever, a body ache, and they don't want to move around, right? They're in pain. And typically the acute symptoms of flu can last between 4 and 7 days, okay? Appetite is usually off and accompanied with that fatigue. And then the second week, so you're almost going to be looking at flu as a 2-week issue. The second week is typically when the cough is more productive. Doesn't mean it's a secondary. The cough is more productive. They're feeling a bit better. The appetite is improving. But again, there's a bit more sputum production, but they're slowly picking up. The problem with flu at times is it can be associated with a post-viral fatigue. Some people, especially adults, they can end up with significant fatigue following a flu infection, and that can last for even weeks. As we said, the problems with flu, for the most part, is they tend to cause complications in the lower respiratory tract. So they are the ones that are inclined to head into a pneumonia, like the cases that I had described a little bit earlier. Colds generally don't tend to do that. Colds tend to go to sinus infections or middle ear infections. Okay, so the important part there is also to note that if a child or even an adult develops a secondary infection from a cold, such as a middle ear infection, it's likely to be bacterial. There are a handful of typical bacteria that cause these infections. But the reality is the medical profession is pushing now to say you shouldn't even give antibiotics in those cases. And the reason being is because at best, you might shorten the course of the condition by 36 hours. You do nothing else. You do nothing else. So you're looking at these situations and saying again, how many of these kinds of conditions can I manage conservatively? How many can I go ahead and just give good hydration? There are things that obviously we would look at prescribing and things that would be available to you even over the counter that you could use in the management of these kinds of conditions, which is really what I'll point out a couple of things for you now. So who could distinguish between a cold and a flu? It's an important distinction to be able to make. Okay, I hope that you'll at least be able to do that, even just listening for 2 or 3 minutes to the person or watching to seeing how the child is presenting. When you're looking at that sort of thing, I'm of the opinion that this is where natural medicine, homeopathy, comes into its own, because the majority of these kinds of infections can be treated very, very successfully, supportively with natural approaches. So whether it's a cold or a flu or even a gastric flu, a diarrhea, most of these kinds of things can be treated very, very well. My brother and I, over the years, have made a point of trying to teach our patients, parents, moms especially, how to distinguish these basic kinds of conditions and how to manage them themselves for the most part. And I'm always amazed when I'll see a mom who said, you know what, I haven't seen you for a year and we had this, but we managed them fine. We've got something a little bit different now. It's always such an encouragement to me, and it should be an encouragement to you as well. You really can be involved in managing a lot of these conditions very, very effectively, even at home. And again, the reason I say that is because remember, the majority of these things are self-limiting, which means that for the most part, they are going to get better. We just need to be patient. Okay. Now, here's one of the challenges. When we have a sick child, of the ways in which we should manage that is we should not send them to a place where there are lots of other children. You know places like that. I think there's schools, right? One of the biggest challenges we face in a school setting is that sick children are often sent to school, and we understand parents are working, parents are under pressure. It's a difficult situation. But the reality is sending a sick child to school increases the risk of other children's health significantly. So when we come into something like this, a flu season, this is when things spread like wildfire, right? And that basically causes problems at every level. So I know it's extremely difficult. I know it's really challenging. But my encouragement to you is if your child is presenting with symptoms of infection for their health and for the health of those who they would be in contact with, try and keep them at home. Again, that's a debate, I know, that is a massive topic, but the reality is if you have the luxury or if you can make that a possibility or an option, do that. I assure you they will recover more quickly and the likelihood of them picking things up from others will be reduced. It's a win-win for the most part for everybody. So I know I just throw it in there, but it is one of the ways we can reduce and prevent the spread of these kinds of infections, and it's helpful. So when we look at, again, prevention, I've given you some ideas on diet and exercise and sleep and stress management. I've given you some ideas as to how to distinguish between the different viral infections, the major ones, and also how to, sort of patiently manage some of these. And if one is inclined to wanting to look at something more natural, those things are available to you. I think one of the things that is really important and helpful at this particular point is to recognize also that if you do choose to manage some of these kinds of conditions at home, which again, I think you should in the majority of cases, look out for the things that might be warning signs that things are going wrong, or that things would be, it would be a time for you to actually go ahead and take them to a medical professional. And there are a couple that I always look out for. When a person brings somebody to me, the things that I'm listening out for, firstly, would be what I call a double dip. In other words, the child gets sick, they seem to be getting better, and then they seem to get sick again. That second dip, if that ties in, for example, a child is presented with a runny nose, sneezing, it sounds like a typical cold, they may have had a low-grade fever, the fever seemed to pass, the child seemed to be getting better, then suddenly the child was off, lethargic, the fever was back. That's usually an indication that there is a secondary infection there. So if you see a child who's sick, who seems to get better, and then suddenly sick again, seldom is that a second primary infection. That's usually secondary, and that might be one that, again, is one that would require management that is outside of the scope of what you would do at home. So look out for a double dip. And the second thing is fever, right? It's not the enemy. Okay, I know people panic when a child has a fever. Fever is the body's response to an invading organism. Fever is what basically heightens the activity of the immune system. Fever is what basically dampens the actual organism's replication. So the viral replication is dampened when there is a fever. Those are good things. So the idea that, again, fever is a problem, fever is not a problem. Fever is God's gift to dealing with infections. Okay, so we must be very cautious in many respects of just trying to suppress that, because we can. But if you see, again, a child, as I said, with a fever who seems to get better, and then a fever again with lethargy, right, who's off their food, you look at them and there's something else going on here, let that be an indication, again, that you probably want to take that child to a doctor sooner rather than later. When it comes to respiratory infections, obviously any pain is an indication that something is wrong, okay? Pain is something that we can manage. Pain is something that you don't have to have a child go through necessarily. So I'm of the opinion that if a child is in pain, okay, give them something for pain. Even if it's going to bring down the fever, I think that's a trade-off worth making, personally. I know others who would disagree, but that would be my take. When it comes to lower respiratory tract infections, the thing that you want to look out for is this. Does the child look as though they are laboring for breath? In other words, they are having difficulty. Are the nasal, are they flaring? Do they seem to be really, really struggling to get breath? And is there an increase in the respiratory rate? Do they look as though they're breathing more rapidly to you? Those would be indications that there is a complication probably in the lower respiratory tract, and that would be indication you need to take them to the doctor right away. Okay. When it comes obviously to sort of gastric flu or diarrhea, the biggest complication there is going to be dehydration. So hydrating through all of these things is very, very important, and making sure that they are getting, again, sufficient fluids in a case of a gastric flu, diarrhea, or vomiting. Electrolytes in that are important. Very important. They can be life-saving. But if you find that the diarrhea or the vomiting is beyond what you're able to replenish, take that child to a healthcare professional. So those are the majority of things that people are going to go ahead and sit with and face. Again, you might have other things. The rule of thumb there is if you're uncertain, rather take the child to go ahead and be seen by somebody who hopefully has an idea of what's happening from that side. So in many respects, we look at it again and we say the majority of infections that we're going to get and our children are going to get better on their own. It's really helpful to try and prevent them along the lines that I've said. It's helpful to recognize the ways in which these things can be managed and how they should not be managed. And it's also useful to recognize what kinds of things should I be looking out for in terms of warning signs that would say I need to go ahead and have this seen to more urgently. Those would be the kinds of things that I would say you could go ahead and do and make use of in terms of information to manage a flu season better, hopefully, than you might have managed it in the past. If you're following these guidelines, I think that's helpful, and you probably will look back and say, yeah, you've seen these things work. If there's one piece that I have to add, okay, it would be the one that whenever there is a mucus-related condition, which again, the majority of these infections are, my strong recommendation is avoid dairy products, okay? If your child has a runny nose, if your child has a cough, if your child is prone to middle ear infections, if your child has these kinds of respiratory issues, milk, cheese, chocolate, ice cream, yogurt, butter, cream, avoid them. Why? They are mucus producers. Thickened mucus blocks things like eustachian tubes and sinuses. Okay? They complicate situations. So I know some people are dead against that because they've been brought up to think milk is, again, the food. Milk is not a health food. I will make that abundantly clear. Milk is a fun food. It's what we put on pizza, and it belongs there, right? But the reality is the dairy products that we are so quick to give our children for strong bones and teeth, it's actually not that helpful, and for the most part is detrimental when they have an infection, okay? I throw that one in there because if ever I saw any of you, I guarantee you that's what I'm going to tell you then. You can have that information for free, right? So in many respects, again, we're looking at something that all of us are going to face, all of our children are going to have. Infections, again, in the particularly young, it's not uncommon in a school setting for them to be sick. I would have said it before, 12 to 16 times a year. That's a lot, okay? That is not an indication that a child has a problem. It means that they are a child exposed, okay? If you follow the guidelines that I've given you, if you apply some of these principles, I think you go a long way in managing and preventing these kinds of conditions. And I hope, again, that that's something that will be helpful to you and your family. So for sake of time, I'm going to cut it there and put it out if there's anybody who has any specific questions. Again, I hope I've provided a sort of a framework for you to just consider these kinds of things. And then we can maybe look at some specifics that would be helpful. Yes?
Thank you for the talk, Dr. Bennett.
Pleasure.
I wanted to ask you, there's this perennial debate between whether a meat-based diet, whether a vegetarian diet is better than a meat-based diet.
Yes.
And I know you talked about a plant-based
Yes.
diet and all of these various things and using supplements.
Mm.
So for those of us who are vegetarian or aspiring to be vegetarian,
Yes.
can you give us your take on what is a better diet? Okay. A lot of people say that you cannot get certain minerals and vitamins, proteins, etc., in sufficient quantity in a vegetarian diet. What's your view on that? And the second question is, if you do cut out the dairy,
Yeah.
I have personally
Yes.
found,
Well
I
done.
came to your clinic
Okay.
and you...
Did I say that? Imagine that.
Sorry?
No, I'm saying, did I say that? Imagine
Your
that.
brother.
No, and he would be 100%
Yeah,
correct.
yeah.
Yes.
And it worked wonders on me.
Great.
Because I have this niggling chronic cough,
Right.
and in about a month it just went.
Good.
It's something that I was suffering from for a long time. So I've had personal experience with what you're saying. So two questions.
Yes.
Plant, vegetarian versus meat, and then if you are cutting out the dairy, how do you supplement it?
Okay, good. So you're right, it is a massive debate because over the last 10 years and maybe the last 5 years especially, there's been a huge push towards ketogenic diets, which means high fat, high protein, okay, and the guys are trying to say that that is the way to go. My assessment of these things is always very, very simple. I try and take it back to what does the cell want? If the cell represents the functional unit of who you are, the question is, what does it need? Okay, that would make sense, right? Your 75 trillion or 100 trillion or 300 trillion, whatever the debate is in terms of how many cells you have, that's the place to begin. What cells need is they need oxygen, they need water, they need building blocks, which for the most part is going to be proteins or amino acids, fats, certain sugars, right? And they need energy, which come from those things, protein, fats, carbohydrates. And they need micronutrients and cofactors. In other words, vitamins and minerals and all those kinds of things. That's what cells need. They need provision of those things. They need protection from the kinds of pollutants and that come in the air, that come in the food, that come in the water, and everything else, and that are produced within the body. And then the body needs to be able to eliminate. It needs to get rid of the things that are either being taken in or being produced within the system. So when one looks at that, one asks, well, what is the primary thing that the body needs? And the reality is it's energy in the form of carbohydrates. That's the primary thing that the body needs. The body requires 50 to 70% of its calorie intake to be in the form of carbohydrate. Well, you don't get that in meat. Neither do you get that in fat. So that's the first part of answering that question. Plant-based diet or plant-strong diet is what provides you with the primary carbohydrate that is required, right? So carbohydrates are not the devil. Carbohydrates are what the body survives on. In fact, when the body is deprived of that through a high-fat or high-protein diet, the body actually makes carbohydrates, glucose, from fat and meat. What does that tell you? To me, it speaks volumes. What does the body want? Carbohydrates, right? So the whole process that is in play there to produce that carbohydrate from fat and protein through ketogenesis or gluconeogenesis, which means, again, making glucose from an amino acid or a fat, producing ketones as a byproduct. It's not a healthy thing, right? That's an indication the system is under stress. The reality is the weight of evidence indicates that people who have a very bad diet, who then eat more animal protein, more fat, for an initial period find an improvement in weight loss, those kinds of things. But that kicks back within 3 to 6 months. So when you compare a plant strong, and the reason I say plant strong is because I'm not advocating necessarily vegetarian or vegan. I do think that they are better. I'm not saying a person has to be totally free of animal products, right? If the person chooses to do that, it's usually for a philosophical or a religious reason more than it is a health reason. However, again, I'll be very, very clear. A person who wants to make it beyond plant strong, but plant only, I do think that that is probably the best provision for what a cell wants. So if I'm looking at the question again, I'm saying the idea that a person needs animal protein, it's not true. Okay? The cell does not need it. The cell can get everything it requires from, again, listen to what I said, a good variety of clean, whole foods, predominantly plants, or only plants if you want, mostly raw, because one's trying to preserve the integrity of certain of the micronutrients. Those are the first 5 points. So if I put a vegan or vegetarian diet through those 5 points as a filter, what do I get? I get a tick, 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 tick. It's working very well for what the cell wants. So the idea that, again, protein, animal fat is an essential component of the diet, not true. Is it an okay part of the diet if the majority of the diet is plant strong? Yes. And that's going to be, you're going to get differences in each individual as well. Some people will be better off with a little bit of animal protein, other people not. How are they going to find that out? Well, more often than not, it's going to be what is their current state of health and what has their experience been. So when it comes to the choice in terms of what I think is a better diet, I think a vegetarian, but remember, vegetarian, vegan, that is not, and it's less on the vegan side, but not vegetarian that is then loading up with refined carbohydrates and highly processed foods. I've seen many vegetarians who are in poor health because what they're choosing to eat might be vegetarian or might fit the mold, but it's poor, it's processed, it's bad, it's no good for them. So it would fail the test on the, is it clean, is it, so it could add to variety, but it's not clean and it's not whole food necessarily. So those would be the two downfalls that you're going to find in a vegetarian program potentially. Vegan program, again, that's usually very strict, right? Those are the ones where you might be looking at and saying, okay, the question mark over deficiencies, which is your second question, might come in. And the thing that they're asking there primarily is, okay, what's going to happen with protein? Well, when you have a good variety of the right kinds of protein-containing vegetables, you should have no issue. So that's the first thing, right? Yes, a lot of the plants are not complete proteins, so they don't give you the full spectrum of amino acids, but the reality is there are some fantastic vegetable options that give you amazing levels of protein and the spread of amino acids that are required. In terms of micronutrients, primarily they're looking at B12 and iron, and the reality is, yes, that's possibly easier to find in meat, that's easier to find in certain organ meats and that sort of thing, but my take would be very, very simple. Do I need to get a B12 or an iron from a source that in and of itself has health risk? I would rather go ahead and get that from a plant or a supplement. And the simple reality is the majority of people should probably be supplementing with B vitamins anyway. So iron is a little bit of a different story because iron in quantities too high can be toxic, right? But most of the supplements will contain levels that, you know, if you're taking according to the recommended dosage, you're unlikely to be sitting with those kinds of issues. So I put the information out there like that, saying again, start with what the cell wants. And the simple reality is what the cell wants and what the cell does best on is probably a vegan, vegetarian kind of program. That's why I say plant strong. And I'm not saying, again, that is to the exclusion of animal proteins. If a person chooses to have fish or chicken or meat, it should probably not make up more, in my opinion, than maybe 10 to 20% of their diet if they're intending to provide the body with what it needs to function at its best. So one can debate those things. I like to just take it back down to cellular level and can debunk most of the arguments that would be presented for ketogenic diets or high protein, high fat, or high animal containing diets. I would say to you that the weight of evidence, not the cherry-picked research that is presented, the weight of evidence highlights the fact that people who take more fruits and vegetables and salads have a longer life expectancy, reduced risk of cancer, reduced risk of heart disease, reduced risk of these kinds of things. To me, that's a no-brainer because, yes, you're providing the cell with what it needs. And when you're doing that, you're providing the body with what it needs to live for as long as possible. So I hope that frames that answer for you. Yes?
Would you recommend the flu vaccine?
Okay. I knew that was coming. So I have two ways of answering that. Number one, this is a talk on natural medicine, so I don't have to answer it. No, I'm teasing. Right. Flu vaccination, it's one of those where, again, the medical profession, as a rule, I'm generalizing, would, when it comes up to flu season, be suggesting flu vaccination across the board. They might be suggesting it especially in those who have some kind of or who are immunocompromised, the elderly, etc. The best way for me to answer that is I don't take it. Okay. Because again, this is a highly debatable area. There are lots of misconceptions. Oftentimes, the reality is the flu vaccination misses the mark for what the strains are. It misses it completely. So the question is exposing myself to, that sort of thing necessary when it might not help? Each person needs to make that decision on their own, in my opinion. I think, again, some of the things that may be helpful would be to recognize some people think that taking the flu vaccine actually produces flu-like symptoms or can induce that kind of thing. I've seen that happen many, many times, but it's very difficult to pinpoint flu-like symptoms to the actual flu vaccination just because they're usually given at times when flu is prevalent. So when you think about the number of people who are contracting flu every day when those things are at their peak, the likelihood that you got the injection at the same time that you had picked up flu is probably high. So it's very difficult to link a lot of those things in terms of causality. So bottom line is, again, I don't take it. I don't give it to my family. I don't specifically recommend it. I usually leave that to the person to say, is this something you've done in the past? They say yes. I say, do you think it works well for you? They say yes. I say, by all means, continue. If they say no, I seem to feel badly, I say, you know what, you're probably not going to die if you don't take it. Why don't you try that? So it's not one that I will take a hard and fast line on. Sure.
Nowadays, doctors prescribe a lot of nebulization.
Mm.
What do you think about that? And is it really necessary?
Okay, so nebulizing obviously is just enabling the inhalation of whether it's saline, which is just a salt water, or an actual medication. So they will nebulize typically with bronchodilators. What you see in a lot of cases, and this is where the pollution might be aggravating these kinds of situations, and children who have picked up certain viral infections like respiratory syncytial virus in the early years can increase their risk of bronchospasm if they pick up a cold or those kinds of things. In those cases, if a person is in respiratory distress, as I mentioned earlier, they seem to be laboring for breath, their respiratory rate is high. When you listen to the chest, you can hear that there is a difficulty to get air in and out of the lungs. That's threatening. So I would say to you that in those cases where that has been identified, nebulizing can be life-saving. So I would strongly advise that, in the right setting, that is used. Now, should everybody be nebulized? Again, typically they use either a combination of saline or a bronchodilator or a steroid, or in severe cases, adrenaline, right? Those kinds of things, I think, when appropriately used, fantastic. Oftentimes if a child is predisposed to an asthma or a hyperreactive airway, they will sometimes be sent home with a nebulizer to nebulize every 6 to 8 hours and that kind of thing. And let me say that in certain cases, that can reduce the risk of complication with a pneumonia and that type of thing. It really can. So again, if you're in that situation, probably the best thing is ask the doctor, why would you want to nebulize? If they say, because the child is in respiratory distress and there seems to be a lot of bronchospasm, be thankful that you have that available to you. Yeah. Yes.
Sorry, about the supplements.
Yes.
Because we talk about not taking the medication,
Yes.
right? So the idea is, so if we're not taking the medication, then why is it okay? I mean, it's kind of produced with the same pharma industry, so why is it okay then to take supplements?
Mm.
So, I mean, okay, not being a biochemist, so I don't understand why we should take all the supplements.
Okay, so it's a great question. It's one that I would normally answer like this. If we were living on an island, right, that provided the best quality food that we picked ripe when all the micronutrients were in the food, and our diet comprised pretty much of everything that I listed, good variety, clean, whole food, plant strong, etc., I would say to you there'd be no need for supplementation. No need. Supplementation, by very definition, means I'm adding something. We sit in a situation where our diets do not provide the degree, the spectrum, the quantity of the micronutrients. We are not talking about supplementing with amino acids or fats or those kinds of things. Maybe some essential fats in certain cases. But the reality is, even the best diets now, in my opinion, do not provide the level of vitamins and minerals and cofactors that are needed for optimal health and function. Part of that, again, is the body is so loaded with the amount of toxicity breathed in, taken in, that they require a lot of specific micronutrients to actually detoxify. And those things are used. It's like breathing. We don't breathe 3 times a day and then carry on for the rest of the day. We keep breathing because that's a requirement. And micronutrients are like that. The body can store amino acids. The body can store, and I say, okay, if the cell requires lots of micronutrients that should be coming my food, but aren't, what's the logical conclusion? The logical conclusion is, let me give them in a way that I know at least the body is going to get them. So that's what we call supplements. The analogy I often use is, if I had a barrel here that was filled with apples, okay, and that's what I needed to consume in the day, but I only had 70% of the barrel full, but I needed the extra 30%, what would I do? Well, I could top it up with those wax kind of apples that you find maybe at IKEA or whatever as a supplement. That's what's happening for the most part in supplementation. They are synthetic. That's unhelpful. I'm not recommending that at all. In fact, I'm recommending against that. What I would do is say, okay, well, what do we have that could provide the extra that I need? Oh, well, over here, this particular group of people, whether pharmaceutical or not, hopefully good manufacturing process is followed, but they went ahead, and when it was a really good apple season, they took the best of apples and they went ahead and they powdered it and they put it into a powder form or a capsule form, and they went ahead and I topped up with that. That, in my mind, is supplementation. And that, That's the challenge, and that's, well, no, it is possible. It's tough. And that's why in so many respects, people like myself are trying to draw attention to the fact that supplementing does not mean walking into a pharmacy and pulling something off the shelf and assuming I got it right. It does require some education, which is why when I would make the recommendation, it would be something as simple as this. If you look on the supplement, if you look on, I'm looking for the things I should be getting in my food. I'm not arguing that that shouldn't be the case. It's not happening. If I'm going to go ahead and take something, let me look and say, does it say vitamin C from and then define the food? Or does it say vitamin C and then ascorbic acid? Well, that's not vitamin C. That's a part of vitamin C. So the simplest thing is read the back and see, does it say food derived? Does it say that kind of thing? If it says that kind of thing, you probably are in the ballpark. So again, the reality is sometimes these require other kinds of discussions where we actually look through and say, well, these are the kinds of brands that produce the kinds of things we're talking about. These are the kinds of brands that are, for the most part, reliable. It's a whole different discussion, but it is doable.
I have one more question.
Sure.
Same thing with the supplements.
Yes.
Sorry, last one. Oh, not last one, maybe. So let's say we took 2 supplements, right? Let's say the doctor recommended take supplements of this brand or of this brand. So we bought 2, and we tested it as through kinesiology on a child.
Yes.
And one of them is absolutely not only like neutral, it's actually bad.
Harmful, sure.
So how then can we figure it out? That's one. And then second also, maybe it's not that specific supplements, maybe he cannot be absorbed. Yes, you might be deficient on vitamin B12 or B2 or whatever it is, but if I'm going to give you B2 now, it might not do any work unless you put something else before.
Mm-hmm. So again, what?
So we need to go to practitioner basically.
Well, no, and in many respects you just answered, you in many ways gave the answer or supported what I was saying earlier. I'm not a great supporter or fan of isolated nutrient or supplements. So for example, take this particular one or that particular one. I'm of the opinion that we're better off taking combinations of varieties. So for example, you're going to take vitamin B2, probably better to take B1, B2, B3, B5, B6, B12, B9, all of them in a combination. You're probably better off. That's more along the lines of how they would come in food anyway. So the reality is, what I'm saying is, yes, be mindful that certain supplements are not supplements in the form that the body wants. Recognize that those, unfortunately, are the majority. Recognize that there are those that you look at, that those that want to make you know that they're food derived, they will tell you. Why? Because they know this is what they should be giving. So they'll make it clearly obvious. And then the same as a food. If you take a supplement, the same as you might introduce a new food, you might say, well, I think mangosteens are a good thing to give to my family, right? So I give this fruit, and I find that 3 of them love it and do well, but 1 seems to get a rash. What am I going to do with the mangosteen? I'm not going to give it to that other one. Same with the supplement. In essence, you won't always know specifically, but you'll be able to look over time. We eat food with the intention of providing the body with what it needs to do its job. The same thing I'm going to try and do with a supplement. Are you going to get it perfectly right all the time? Well, probably not, but you're neither going to get that with food, which is why the body, in its incredible design, is able to go ahead and pick and choose a lot of what it wants and get rid of the extras. So it's important to identify again that there are certain things that are really helpful and others that are not, and try and lean on the helpful side. And yes, if you need to support in that, well, that is understandable. But every single subject we've discussed today, right, every single one is a day's discussion on its own. I hope that you can take away a few guiding principles more than anything else. Okay? Good.
Thank you, everyone. And thank you so much, Dr.
Thank you for having me.
Can you hear me? Because I think the mic's down there. So my name's Christina, and I work with the Marketing and Communications Department. And Dr. Penny and I were speaking earlier about putting together a PDF of
I will try and
supplements,
do something like that.
that Dr. Ryan recommends. So I'd love to be able to send that out to you after this session. I've got all of your names here from when you RSVP. So if you could tick your name as you leave, I'll leave it on here, and then we'll send that PDF out to you.
Can I interrupt you for 1 second? That's probably not coming today or even next week, when I find a gap somewhere before flu season is over. Okay. So
Once it's finished, we have more time probably.
say again, sorry?
Once the flu season is over.
Well, we've got next year then. Sure, next year we'll be ready for then. So.
It's okay. And prizes as well today. Dr. Penny has a supplement here. It's a brand new supplement. And we also have a free 60-minute wellness consultation with Dr. Penny at his practice at the clinic.
Sure.
So we have a few questions to ask for
Sure.
to win these lovely prizes.
These basic ones I pulled from the clinic just in case I was going to show them out, but this one is mine personally, so I can give this one away. We used to have a product called Immune 360, which was our go-to immune support product that we've struggled tremendously to go ahead and get. We've been able to get the replacement, which arrived on Sunday morning in Dubai. We are so relieved. And yeah, so that is the Immune Pro that I would love to give to somebody who can answer. Let's see. Let me put it out. What's probably the most important way of avoiding the kind of complication that I described with the death of that little one and that older gentleman? What's probably the most important in one word? Milk. Okay, not the word I have in mind.
Wash hands.
Okay, what is that trying to do? What was that? Where did I hear? Prevention. Whoever the prevention person is, prevention, absolutely. Prevention is way better than anything else. So whoever said that, I'm not going to be the judge. Okay, so prevention. Just a quick one. Standard dosage, 2 a day. Take them with food. They're extremely concentrated. If you take them on an empty stomach, you'll feel nauseous.
Thank you.
Pleasure. Okay, so that was number 1. Who's coming to see me? You're welcome to join me at the clinic for an hour, and we can chat about whatever you would like to chat about. Let me think. I'm not going to pick, right? I'm not going to pick, but I will put the question out there. Give me one key difference between a cold and a flu.
Lethargy.
Which one is mainly?
Flu.
Is lethargy. I will see you when when you give a call. Good? Thank you for having me. I must rush. I hope that was helpful. Okay.